abysmal. Overall, it is negative, and overall, it is not even close to what we should be learning. There is a lot of joy and pleasure to be had when you do activate your sexual agency. When you activate your agency, it does not mean you're saying yes to everything. It often means you're saying no as well. One of my favorite stories is a story of a man who started a book club, and it was in Louisville, Kentucky, and I love it. And he was like, dudes, we got to get it together. Like, our women are suffering. What you didn't get at 10, and then you didn't get at 12 and 15 and 20 and 30, when you are 55 and you haven't touched yourself, you haven't looked at yourself, and I'm telling you, an estrogen cream could really make a difference. Or if you are 80, and it could literally save your life, because so many women can die from sepsis from a UTI, then we have failed a woman her whole life.
Welcome back to the Uncover Your Eyes podcast. I'm your host, Dr. Meenal Agarwal. If you haven't already hit the follow or subscribe button, please do so. Let us know you're listening. It helps us to bring you better episodes weekly. Today, we're diving deep into a conversation that affects many women, yet we are silent about. Why intimacy and connection shifts during perimenopause. Studies show that up to 50% of women in midlife report a decline in sexual satisfaction, and nearly 1 in 2 experience changes in desire or intimacy that affect their relationships. Yet shame, stigma, and silence keep most of us from asking for help. Today's guest, Dr. Juliana Hauser, is a therapist and the author of A New Position on Sex. She brings a refreshing and empowering approach to sexual health, one that shifts the focus from performance and pleasure to sexual well-being, agency, and authentic connection. If you've ever wondered what's happening to me, or how can I reconnect with my partner or even myself, this episode is for you. Thank you so much, Juliana, for your time today. I really appreciate you being on today.
I'm so glad to be here. Thank you so much for inviting me.
So, I'm excited with your new book, and I have so many questions. And I guess I'm going to start at the beginning. What happens in this shift during perimenopause, menopause, where women feel different about their sexual health?
Mm-hmm. I'm so glad that you're asking it, and I love it that you're starting out of the gate with it, because it's a topic that people in general are afraid to talk about and to ask about, but yet it is happening. So thank you for being in the forefront of that. So there are a variety of things that can change, and I want to also start off by saying not everybody does experience a change. One of the things that makes perimenopause and menopause so tricky is that there doesn't seem to be a lot of prediction as to how what parts are going to change during perimenopause and what's going to happen in menopause. But there are options that could occur. First, I'll start with the lowering of estrogen. There is a link with the change of your vaginal tissue, and that can result in a loss of lubrication. It can result in easier tearing of the vaginal tissue. It can result in increased pain, discomfort to pain, either just before, during, or after penetration. And there are several things you can do to help with that. But it is, for most women, it's a pretty quick coming on. Like some people would describe it as almost overnight, that something's changed inside of them and they're noticing different. And there are other people that feel like it's more gradual and it just becomes one of many symptoms, and they realize, oh, I wasn't even thinking that was one of them. Another thing that can happen in your sexual health is that your lowering of testosterone is linked with your change of libido. And I mean, it could be accurate to say a lowering of your libido, but I like to really look at our desire and libido as a relationship, not necessarily on the scale. We already in the sexual space have a tendency to do right and wrong, and particularly within desire and libido, it's your libido is too much or it's too low, and so I try to shy away from that verbiage and just say your relationship with your desire and libido can change with the lowering of testosterone. The list can go on and on and on. So I don't want to be overwhelming in the negative of it. But another thing that happens with the lowering of progesterone is that it is so highly linked to your sleep and for the calming aspect of life, that when your sleep is disrupted, that then has a cascading effect on all aspects of your sexual health too. Your interest in it, you're too tired to be interested in it or to be a part of the physical activity of it. It can be hard to make decisions. It can be harder to speak up for yourself, and all of that relates to your sexual well-being also.
I mean, women are going through all these changes during perimenopause, menopause, and this is a big one that a lot of them, we don't talk about and we don't hear about it.
Mm,
Um, and I feel, even friends in their 40s, 50s, we don't talk about those things. So why do
yeah.
you think it's stigmatized or not discussed?
In general, we are not giving a robust education if you're given any kind of sex education at all. And it varies, from country to country, and depending on what your era was in which you'd be sex educated. But overall, it's abysmal. Overall, it is negative, and overall, it is not even close to what we should be learning. And when aren't resourced, when you don't have accurate information or access to accurate information, then you are automatically at a disadvantage of having conversations in your longevity of your sexual health. um, Sex education is often fear based. It is often don't do this, or this bad thing will happen. And it rarely involves anything outside of the puberty age. So, learning how your body is going to age and your sexual health is virtually non existent, especially getting into perimenopause and menopause. There is not one thing out there that's going to be teaching a 13-year-old girl that eventually you will be in something called perimenopause and menopause. And I want to give another example. I spoke at Yale in the spring, and I was speaking to therapists. That was the audience members, and I was talking about perimenopause and menopause and the effects with mental health. And I had a therapist raise her hand and say, "I'm embarrassed to say this, but can you explain what perimenopause is?" And this is a highly educated person in the mental health field who doesn't even know what
Wow.
the term
Yeah.
is. And then you put that into this is if you're, and this was just kind of your regular mental health, but even in those who are specialized in sex therapy or in sexual wellness, we're not being taught it. So professionals aren't being taught it. The everyday person isn't being taught it. Yet sex is being had, and if you're breathing, you're a sexual person, and then we're expected to talk about it and and know what words to use, know how to reduce the shame that we have. There is a very long list of what is added on to the shame and who we are as sexual beings, and we're not given a lot of role models. I am fortunate that being in the sex education world, that I'm around a lot of people who do model being able to speak about sexuality. So I know that I have a skewed view of it, and I'm fortunate on a personal level that I'm able to do that. And I still can have a difficulty in advocating for my own needs and speaking about my sexual health. I do work to make sure that I have providers that are comfortable with it, and that I bring a certain level of comfort to the conversation. And so I know that if I'm in this space very often, and there still is a bit of discomfort for me, for those who aren't in it and haven't been in it for the amount of years I have, it's really difficult.
So, how do women recognize that besides the painful part of intercourse, how do they recognize that they're not, I always attribute things to like, I'm tired and, I'm a
Yeah,
working mom, I'm busy, kids are being mean to me, screaming at me all
right.
the time. Like, we're tired. So, how do we know what is tiredness versus the signs that we need help to talk about these things?
There are going to be times that you don't know, that the overlap of the life load and your hormonal changes and your life experience and relationships interacting with both of those things, sometimes it's hard to parse out. It is. Other times, what I hear is an increase of I don't feel like myself. Like hearing that phrasing to me, I associate at a certain, like when somebody is getting into the perimenopause age range, when I hear that, I think I lean more towards this being a hormonal issue that's intersecting with life load and perhaps relationship things. And I make sure to ask a lot of questions to suss that out. The other thing is that I have an increase of people saying, I'm worried about you. Things are different. This feels different, whether it's in a sexual context or something else. So those are two telltale signs that I look at. But a lot of times I look at it as a spider web, that it's not just one thing, it's a multiple things. And if the problem is caused by multiple things, it means the solution is going to have to be multifaceted also.
Is there a difference between pleasure and sexual health or well-being?
Oh, what a great question. There is a difference, but it is highly correlated. So sexual, the international definition of what sexual health and wellness is technically like it's not just the absence of disease and dysfunction. It also involves the psychosocial, the societal context, the biologic and the psychologic wellness in a sexual it's such a kind of a boring kind of answer and definition. And as you notice, I didn't say the word pleasure in that. So the traditional and the overall accepted official definition of sexual wellness it doesn't address pleasure at all. It hints towards it being more of an individual aspect of it when you break down each one of the biologic and psychosocial aspect of it. But when you're looking at holistic sexuality, when you're looking at a holistic sexual wellness, you are including pleasure as an aspect of it. And that is pleasure inside and outside of sexual context. And when I say sexual context, I mean sex acts.
Okay, I'm like trying to grasp all this. This is the first time I've
It's a
talked about it
lot.
with
It is a
somebody.
lot.
So you speak about sexual agency. What
Mhm.
does that mean? I don't get the term and the concept around that.
Yeah, I appreciate that honesty because it is a word that has multiple meanings to people, and there isn't necessarily like an agreed upon definition of the concept that I'm speaking of. And this is how I look at it. I have it distilled down to one sentence, and then I'll go deeper into it. But basically, agency in general is knowing your terms, so knowing your yeses and nos, which means that you know yourself and you've done self reflection and you've done self development in order with purpose and intention to have an answer that feels authentically yes, authentically no. And then the second part of that is so you learn your terms and then you have to live your terms. And it is one thing to know what your yes and no is. It is another skill to learn how to behave in that, to ask for it, to stand by the yes or the no in the terms that you have. So you need to know him, and then you need to live them. And and I've looked at agency for 20 years and have found it's a noun, a verb, it's a concept, and it's a skill. And it is one of my favorite things to do is to teach people the skill of agency. And it sounds so easy and it sounds so boring. And I, if I was listening to me, I would think it took you 20 years to come up with 5 steps of agency. Wow. But once you figure it out, the more I have learned in life that when something seems really simple, it actually means it's quite complicated. And agency is like that too. So, in the skill of agency, it's the process of breaking down how do you make a decision. And you want to make a decision in agency, which means a decision that has a lot of purpose and intention in it, a lot of intentionality and awareness associated with it. You don't just kind of fall into it or wait until there's no decision. You don't let there be a decision by committee, but you really show up for yourself. And to back that up, like the first thing is that you have to know there's a decision to be made. And there's a lot of times that we're all of a sudden, especially when we put it in a sexual context, that I was so many stories of people saying, I mean, before I knew it, we were doing this sex act. And I didn't say no. I didn't feel like it was assault, but I never really thought, do I want to be doing this? And do I want to be doing it with this person? But here we are. So I guess, I'll just, play ball with it. And I just have thousands of stories about that. And those stories don't necessarily end in harm or in something that needs healing. But if you stack up a lot of instances where you're not showing up for the decision itself and thinking like, do I want to do this? Do I not want to do this? Inside and outside of sexual context, you start building up a muscle memory of not showing up for yourself. And when you have a muscle memory of self-abandonment, that is when you start having a much harder access to making decisions that really serve your greater good. And when we have people that don't know who they are, that are not making purposeful and intentional decisions, relationships become very toxic and very strained. Communities, families, cultures, countries start having a lot of difficulties. And that's a lot to say after saying, wow, you just have to know there's a decision to be made. And the answer is yes. Yeah, it starts there. But there's 4 other steps that are included in it. And as a therapist, my work really intersects when I work with somebody in their mental health space, and then when my sex education part of me, when I look at sexual agency. And a lot of people come to me when they have not activated their agency within who they are as a sexual being. And of course, that includes power and trauma in the typical definition that we know, but it's also much greater than that as well. There's a lot of places where when we don't enact our sexual agency, our decision making in our agency, that there are very big consequences or ripple effects. And there is a lot of joy and pleasure to be had when you do activate your sexual agency. And sexual agency does not, when you activate your agency, it does not mean you're saying yes to everything. It often means you're saying no as well.
Okay. I mean, I have a few questions about that. So,
Yeah.
my first is, for the women out there that are with their partners that, they're happy with, been happy with for 20 years, say, what does sexual agency look like for them in terms of, if you can give me an example of what the yeses and nos would be in a situation with them where they are happy with their partner.
Mhm.
So, what does that mean?
So we'll put this in the context of your relationship with desire has changed, and you are finding that you want to sleep a lot more. It's harder to sleep. You're waking up a lot more tired. And when you start winding back the clock of their schedules and getting, if you have kids and work, all of a sudden you have this sweet spot of about 45 minutes that everything is put away and before you need to go to bed. Your agency, your yes or your no would be, do I want to sexually connect with my partner? And what makes that question complicated is, what is want in that? Want can sound like I'd like to, but I mean, the runway from where I feel right now to what it would take for me to actually be naked and doing this, it's so far. I can't even deal. Nope, too tired. So I want to, but I don't want to. I can't imagine it happening. Another thing could be, um, in that window is, sex is fine, but it's not great. It doesn't feel nearly as good anymore. But it does feel great is watching this Netflix show,
Yeah,
and
yeah.
or cuddling, and we got stuff to talk about. We have to talk about what we're going to do tomorrow, and all of a sudden a sexual connection, because there's hurdles to it and there's not a guaranteed, wonderful, pleasurable part of it. It starts getting lower and lower on the list, and that starts happening more often. And then want becomes a loaded word, which becomes like a conflict between people, which is, you never want this anymore. Why
Right.
don't you want this? Or an internal part, which is like, I want it, but I do not want it. And so your yeses and nos to that wanting starts becoming multiple in the ways that you have to answer it. And with all of that, you want to have a grounding of like, what is the truth? And I have a lot of women that say, I don't want to have sex, but I don't want to lose this great relationship. Or my husband, poor guy, he's not getting it anywhere, like things like that. And so they push through it, because as women, we are taught to push through everything. And so the wanting becomes very muddied. And that's oftentimes when people come to me, which is, I want to want it, but I don't know how.
So how? Like, what is the change that, I mean, I think a lot of women fall in that category. I mean, I've talked to so many friends, and you can sense that that is the category many women are in right now,
Mhm.
where they are tired and they would rather watch that Netflix show.
Mhm.
But at the same time, they feel like they need to be with their partner, they need to keep their partner, and that's how to satisfy. And so what are some steps, or I don't
Mhm.
know if men understand this. Like, I can't imagine we can just sit them down and talk to them and they'll be like, okay, so what are the some
Yeah.
steps that we can take, or to
Yeah.
help make that shift?
I want you to look at it like it's a wheel. That it's not going to be a staircase. It's going to be that we have to just keep pivoting to see which one it is, and we need to do a lot of things to figure it out. And you have to have a lot of patience as you go into the process. Patience and curiosity is the vibe that you want to bring into looking at a change in your sexual life during menopause, perimenopause, and menopause. So, in no particular order, we'll start with spouses. Do you have a relationship that's supportive? Do you have a relationship that you can be vulnerable and you can say specific things like, it hurts when we do this, or is that not what this relationship has? And if you're not used to communicating like that, what do you need to do in order to get to a place where you can have that kind of conversation? Um, and I'll say this very often, like, okay, so do you all have good sex? Whenever when it magically does happen, is it good? Like, do you like it? Are you finding pleasure in it? Because why are we going to be doing all these things to get to something that doesn't feel good to either of you or one of you? And so I like to give room to say, actually my partner's not very good, and I've been lying about it for so long that I don't even know how to tell them that that move or that whatever is something I don't like, or it doesn't feel good, or they're
Mhm.
not good at it. So I give room for that. Again, that's not necessarily where we start, but it's a part of it. Or what shame or hangups do you have about who you are as a sexual being, or what you're needing right now? And so we unpack that aspect of it. Another thing is looking at, are there products that can make a difference, that will help with the wanting? So are you doing, like, just like we often have a daily face regime? Are you doing a daily vaginal regime? Are you doing a moisturizer? Are you looking at the products that you can use on a daily basis, not just lubrication for when you want to be sexually active? And so a lot of it's education. Like, what are your options out there? What are the issues, and what are the options for solutions in that? And do you feel comfortable asking a medical provider? Do you feel comfortable ordering it online? Where are you in your ability to resource yourself with products that can support you? Another place to look at is remove the shoulds. Remove it. There is no, I refuse to answer the question, what is a normal sex life, or how many times should you be having sex a week? Because there really isn't.
Mhm.
And it's so individual that it's just honestly a worthless stat to give. I like to talk about the quality of your sexual connection, not the quantity of it, unless the quantity is, an outlier number and something that both partners don't feel is what they want to have. But it's remove the shoulds, remove your partners, your own expectations. You need to remove what things used to be like. You need to remove what society says, and start looking at the where I am now and what do I want now. So I will ask a woman, do the truth of it all without any consequences outside of this. Do you want to have any kind of sexual activity with your partner? And I love it when a woman pauses and wonders. And when they have a space to say, I don't know, then I know we have a lot to work with. I'm not afraid of I don't know. I actually think it's a beautiful beginning point. Yeses and nos are great too. You can't accept somebody's yes until you can, trust their nos, and vice versa. But I a lot of times we don't even stop to ask ourselves that, which is what I was saying earlier about agency. So just looking at what do you want, and if the answer is I I really am okay not loving having this sex act because I know my partner does. Like I that is something I want to give. It's not a sacrifice for me. It's not harmful to me. Um, and she gets to decide that. I don't think it should be put upon her. And I'm
Right.
not someone that thinks that you should push through those things. But if it's something that feels like a nudge and not a shove, then I'm on board with that. And then sometimes I'll be like, I would like once a week. I just don't know how to get there. And so just giving yourself the room to design your own sexual life first. And then if you're in a partnership, doing it with your partner and inviting your partner into that decision making thing too. Because depending on the age of your partner, you are like, if you're similar ages, you're aging together and you're having issues together, and you need to work in tandem. And so it's, or you need to be preparing for that. And I have found, and when I'm working with couples, I'll say, well, somebody's going to go first. So whoever it is that goes first with something changing in their sexual health and functioning is going to set the scene for the whoever's going second. And so if you're not the one that's having the issue right now, then be a really good partner, because your time's coming, and you need to be the person now that you need your partner to be for you down the road, because it's coming for you if you're lucky enough to live long enough for those things to change. I also think we've got to, this is an age that it's time to, like, we all know that the We Do Not Care Club is so popular. And one of the reasons why it's so popular is because it's time to shed those things. And I think we start with the removing the shoulds that we have adopted, but we also need to then do a greater look at where are we getting lots of shoulds and directions from religion, from culture, from family, from upbringing, and really decide. I kind of liking it to like cleaning out the closet. You need to decide: does this viewpoint, is this something that I want to keep? Is it something that I need to tweak, like recycle, or is it something that I need to donate and get rid of? And we should do that with how we look at who we are as sexual beings and our sexual values, as part of the 360. If we're talking about pleasure, if we're talking about libido or desire, and if we're talking about our agency.
I know you, in your book, you talk a lot about the pillars of sexuality and connection, which you spoke about already is one of them. What are some of the other pillars?
Yes. So I based the 9 pillars on Dr. Dennis Daly in 1981 came out with the circles of sexuality, and at the time, so 81, if you think about that, it was revolutionary to say anything besides sex acts and reproduction had anything to do with sexuality. So and also I'm sure it was not just him, but he's the one that got the credit for it. So his name's attached to it, but it has never been updated ever, which is absurd to me, that there's nothing that is that static, especially something as fluid as sexuality and sexual culture. And I remember I kept looking around like, where's the updated one? Like, where is it? I Google it. It's like, oh, it's still the same thing. So like, okay, well, I'm going to do it then. So it's based in his foundational work, and then I have updated it. So they are sensuality, there is wellness and fertility, pleasure, then desire. There is intersecting identities. There is sex acts and interest. There is power and trauma, connection and relationship. And then the hub of all of it is agency.
Wow. Wow.
It's a lot.
That's a lot of,
It's a
yeah,
lot.
a lot of
It is.
aspects. Who would have ever
It
thought,
is.
right?
And it's one of the reasons that when I put it together, and I do think it's, I like it that my training as a therapist intersects with my training as a sex educator, because that this model really is a representation of that, because I believe that sexuality, holistic sexuality, is the final frontier of self-development. I believe it's one of the pillars of who we are as humans that is often last on the list. If it's even ever dealt with, it's last on the list for most people, because it feels like it's a luxury instead of a necessity, because we haven't been taught accurately what holistic sexuality is. And those 9 pillars, as you said, it's a lot, but it really, what it is it's the 360 of who we are as humans. when you look at all of those areas, you are looking at yourself in many different facets. And when you do that, you walk out with a very deepened view of who you are, which allows you to connect with people on a much deeper level as well. And when you know who you are, and you are in agency, and you are someone that other people can be the truth to who they are to, that's when you have the richest relationships, whether that's family, or that is friendship, or that is sexual. It absolutely improves the quality of how you're showing up in the world and how the world experiences you.
Do you feel that, I mean, women are going through these changes in perimenopause, menopause, and I'm assuming many of them are, having that, lack of sexual desire, pleasure, and losing that sense of sexual agency, like you mentioned. Do you feel that men are experiencing things because of that? And there's that, well, I mean, they go through their own changes in terms of midlife,
Mm-hmm.
midlife
Yeah.
crisis, whatever you want to call it. That I
Mm-hmm.
always say they go through last, but they go through their own things. Do you think that do they need to be as on top of things as women during this period?
Mm-hmm. Yes. And I want to, I'll speak to that directly, but I just want to make a note that a lot of times in the conversations about perimenopause and menopause, there's an assumption that you're partnered. And I want to say it to the ladies who are not, that there are ways to talk about what I'm about to say with a friend. I call it like have an aging mentor, or have a menopause buddy with you. Even if you're partners, sometimes partners aren't good, and they're not good about this, so you need to find someone outside of the partnership either. But the overall point is, this is such a life altering experience that you shouldn't do it alone. And I frankly think you can't do it alone. And so to answer your specific question, yes, this affects men who are in relationships with women going through perimenopause and menopause. It absolutely affects them. And the smart ones are the ones that educate themselves on what this is. One of my favorite stories is a story of a man who started a book club. And it was in Louisville, Kentucky, and I love it. And he was like, dudes, we got to get it together. Like, our women are suffering. And like, she's got to go take care of her body. I got to educate myself. And he's like, I was halfway through this book, and I was like, none of my friends know this. And so they formed a book club just on menopause. I mean, bless that. That is incredible. It shouldn't sound like such an award, but it is, because it's not typical. I'm a part of Dr. Vonda Wrights does retreats, and she was doing them in the past couple of years, like groups of like 30 women. And there were several times that someone's spouse came along with them. They weren't allowed in the classes actually, but they came down there just almost by osmosis, and they wanted to show their partner, this matters. Like, this is affecting your body, but it matters to me that you're suffering so much, and I want to take away some of that emotional burden for you. While, like, similar to how you would look at someone who's going through cancer, you're not asking their job is to go through treatment and to work through that disease process and the healing process. You don't need to be doing this and this. Let me do that for you. That is the attitude we should be having about perimenopause and menopause. And culturally, we are getting better at understanding that, but culturally we have not figured that out yet. Like, it should be alarm bells and a parade that happens. That's what I want to be. Like, okay, it's starting. She's starting. Let's get it going. She gets a new jacket. We've got a notebook over here. He's got this swag over here, and we're about to go. And I had a hysterectomy a year ago, and I remember thinking, like, this is this big thing that's happening to my life, and instead of my body deciding and going it through it in a more gradual way, I was in menopause in an instant, because I had everything taken out. And I remember thinking, I want this to matter more. And I don't mean it to the world, but like, to the world. I remember sitting my kids down, and I was like, I feel like I'm about to tell you that I'm starting my first period, but what I'm telling you is I'm about to have my last. And there's some, pretty big changes that are going to happen that I have no way to predict. But I know I'm going to be different. And I need us to be team mommy on this. And I said to them, I have a 26-year-old and an 11-year-old, a 26-year-old boy and 11-year-old daughter. And bless their hearts for being in my life. They hear lots of things, and they are along for the ride, but they're just looking at me. They're like, okay, mom. And I was like, I need you to be my eyes and ears. And I need you to, I'm there are going to be times that I don't even know I'm different, or that there's a symptom that is out there. And I need you to be able to tell me it. And I want you to know right now, this is how to say it to me. And if you say these words, that's our code words, that even if I'm like losing my mind, that I'm like, oh, they're being menopause friendly right now, and I'm going to be here to receive what they're witnessing. And I am so glad that I did, and I just made that up. I hadn't heard anyone else doing that. I just felt like I needed to be proactive in the communication. And it made a really big difference in how that happened. And I ended up experiencing quite a bit of depression that I've never experienced before. And my and my family was able to point that out to me when I wasn't even aware. And I'm a therapist, and I wasn't aware
Mhm.
of what was going on with me. And I know that doesn't directly relate to sexual health, but it does relate to it. The skill of it relates to it, and your mental health is has an enormous impact on your sexual health too.
Yeah, wow. Thank you for sharing that with us. That's
Yeah.
empowering for a lot of women out there. In terms of outside forces, do they affect our sexual agency?
Hmm. Yes. And I will just tiptoe into the political space um, that is the dumpster fire of America right now, of where we are with our sexual culture. It is the amount of grieving that I hear women having privately to me as a client, and then just as an advocate. I have never experienced this level of we are under attack, and it's everything, and it's not just our reproductive health, it's our menopausal health, it's our hormonal health, it's that, and it's people saying I don't feel safe to be a woman on about 100 layers right now. And that not feeling safe, and I think that it's not just America. There are other countries that even are in a worse situation than America, and every country has their own version of not being supportive legislatively or as a government to it. Um, I I think that cannot be underestimated. If you have a political culture or a country that in general makes women do a lot of work to be recognized in needing help, in whether it's sexual help, whether it's menopause help, any of that. And there's a lot of countries where women have to do that, and there's a lot of countries where there are political policies that are actively hurting that. And if that's just humming in the background, it is a very difficult thing for women sometimes to suss out, or they have to tune it out because it's too much. And the tuning out takes so much energy. It takes away energy to do other things. Then you add in the life load, like the external factors that you're speaking about. Of a lot of times at this age, you've got parents that are dying or are ill, and you are helping in some way. You have kids that could be, I mean, I'm a little non-traditional age wise, but because I have a sixth grader, but a lot of people have, if they have children, they are going off to college, or they're finishing up that time period, or already gone, and you're changing your roles in that. A lot of people, if they are working outside the home, that this is either the height of a career or their career has already peaked and they're going down. They're trying to figure out what that means. And you're supposed to shower and feel sexy and figure out your hormones, and your hair is falling out maybe, and you've got another 10 episode 10 symptoms that you don't know what it is, and really you just want to stop all of it, and
Yeah.
figure out what ease means for you.
So we're in Ontario here, and I definitely feel what you were talking about in terms of when I see my patients who are coming into me just for eye checkups, but so many of them have menopause symptoms beyond just the eyes, and a lot of them feel like the system is against them. They feel they're going to their family doctor who only has so many minutes in a day to talk
Mhm.
about the most pressing issues, but they don't know where to go from there. And we don't have a lot of menopause health clinics, very
Yes.
few. And to get in with like an OB or a gyne is years. And it's just, it's a healthcare system that's built like almost against us. We need,
Mhm.
for us, we need more of those private clinics that are just menopause clinics, talking about it and catering to us. So that's a big issue that we find here. Do you find like,
Mhm.
for me, I
And
never
I hate knowing that, and I know that's true. As told you earlier, like my mother is Canadian, so I'm half Canadian, so I know it as a family sense, and then I have a lot of clients in Canada, and I'm very aware of it. That and there are some countries that it's not like that, which is actually been hard. Like when I thought it's just like this is the way of the world, I was like, well, it's the way of the world, but I was like, oh, there are countries who have figured this out that don't do
yeah.
this to women. It feels even worse if it feels so purposeful, and in some ways it is.
Yeah,
You know,
like I
I
had a lady who said to me the other day, she said, for the last couple of years, and again, we're just doing an eye checkup, and she said, for the last couple of years, I've been, I can't sleep with my husband. I cannot sleep next to him. And we just don't communicate. And I feel like I need to scream at him all the time. She's like, I can't even stand that he's in my space, even if he hasn't said anything. And I'm
Mhm,
like, okay, we need to talk to somebody. But these are things I wish our healthcare providers were talking about.
agreed.
So what are your thoughts on, like, I know time is an issue, time constraint,
Mhm.
but do you feel that, for us it's family doctors, like do you feel like we're just not educated in that space even as doctors? Do you feel like we don't have enough time to talk about sexual health, or is it a stigma amongst doctors themselves?
Mhm. It's all of the above and what you just said, and I wanna step back and say, there's something special about you that had your patient open up to you and say those things to you, and it's your personality. It is you have an openness. It means that you have made a relationship where somebody feels like they can say it because you're right. There is not an obvious link to that topic and what she's coming there for, but that's also the level. So it's you have provided that. So you have a special sauce that sometimes can't be taught. Also, that's how desperate women are. If they can find anybody in their medical support world that will listen and doesn't just shut them down when you, because you could have shut her down, and
Mhm.
or your attitude or your you could have with your words or your demeanor could have shut her down, but you didn't. Um, it's there's that. Then there's the part of doctors are humans. They are humans who are also personally not sex educated. And they were given the same sex education we were. And most medical schools do not provide, well, they don't provide holistic sexuality education for sure, but they don't provide the level of care of how do you talk about this kind of topic. And these are the kind of topics that are going to be coming up, and especially within the complexity of the intersection of menopause and sex. Those are two very taboo topics that are not it's starting to be the case, but it certainly wasn't for the people that we are seeing in the medical providers. Their education did not include that. And I'm not just picking on the medical profession. Therapists aren't either. I had one elective class on sex in all of my years of education to get my doctorate. I didn't have to take it; it was elective, and you don't have to have one class in sexuality to get your license, except for one state in the United States. And I never once was perimenopause or menopause spoken ever in my training as anything. So it's just in general, we are not doing a good job. Again, the system feels really stacked against us. But for doctors, um, insurance are the time frame does not allow for rapport building that you have to have in order to be able to be a safe person for those conversations that someone's going to open up. So even if you know the right things to say, if someone's reticent to answer, or they don't know if they can trust you, you are not going to get that with one 15-minute visit. You're just not. Even
Mhm.
if you say
Yeah.
all the right things, you're just not going to get it. It's a topic that it's one of the things I get in my work. It takes a long time for people to trust. and to know I'm a person that isn't going to judge them or shut them down. And there's no way that can happen in 15 minutes. No way. I'm fortunate that where I am, I have access and I have the money to go to a concierge menopause specialist. I can't imagine what this year would have been like without that. I can't. And I do imagine it because I know most people can't have that or don't have the ability, they don't have access to that. And I when I talk to my provider and ask her just more of a bigger picture of it, she said the same thing. She's like, it just was unethical. I felt I was being unethical in a 15-minute appointment, having to get all these things in, and then maybe she'd come in 3 months later because it was so hard to get in with me. Like, that's just not a way to practice. We're not serving women when that's the level of appointment. My first appointment with her was over an hour, and not every appointment is an hour, but a lot of my appointments are half an hour. And because she can charge more, she doesn't have to take as many clients, so she has
Right.
more space. And she's happier. And a happier, not burned out doctor has more of a demeanor that's a whole lot more opening, because doctors are worked to death in so many circumstances and are not given a lot of respect. They take the brunt of what actually is from insurance and the insurance industry that's doing it, but they're the front line, so they're getting it. And again, they're humans. Maybe they had a bad day,
Yeah.
or maybe they are having vaginal issues, or their marriage is falling apart, and you've just said something that they're going through, but they don't have time to have a therapist because they're working themselves to death. Like, there's a lot. I have so much empathy for the medical profession and for those who are doing it. And when I meet somebody like you, and the leaders in the menopause world, and those who are the unsung heroes that aren't visible but are doing the work, if you have all that happening and you get yourself to become a menopause specialist, you are in the special class, because you're not getting paid to get that specialty, and you have to work for it. You have to get your own certification. You have to go to these workshops and pay the money to be a part of these things. It's not, you're not thanked for it. There's no parade that says thank you for going the extra mile for learning about menopause. Thank you for doing that. You're not. And and women who do feel grateful that they have someone like you that they can say this to, they have 15 minutes with you, so they can't do a 5 minutes of gratefulness to you. In that, they may feel it, but they got to get in and out too. So one of the things
Yeah.
that I do like to teach people is how to make the most of your appointment, how to get ready for it, and if you're in a system that allows you any kind of choice of your provider, how to discern who the right kind of provider is. And I'm probably more of an outlier, but the first thing I do when I have a new provider is I say, really, almost no matter what. Um, I don't think I've said it to my dentist, but I've said it to almost other providers: how much do you care about my sexual health? And how they respond to it. Not necessarily what they say, but how they respond to it. I love it when they laugh. I love it when they're like, oh, okay. Like, or if they're like, a lot. I care a lot about it. But if they shut me down, if they're like, oh, like inappropriate, I don't care. It doesn't matter they didn't have an answer to it. I care that attitude is going to shut me down. And I have to do so much work, even in the expertise that I have in this field. And I am talking about this all the time. If you're going to shut me down with a topic that you're surprised that I'm asking you, then if I have any shame or worry attached to the question that I have to ask you a year from now, you will not be the person that I'm going to be able to ask. And that could cost my life. That could cost my relationship. And if I had the ability to change, and I know not everybody does, but if you do, then goodbye, because I care about my sexual health, and I care about my relationships, and I care about my longevity. And that may sound pretty far to say, but I do want to give an example of what happens in the ripple effect of not being properly sex educated in an evolved and elevated way. So a lot of times when I'm working with a woman in perimenopause and menopause, vaginal estrogen, like cream, is an option to help with a multitude of issues. And I know instantly if that is a yes or a no to somebody. And if it's a yes, great, we move on. And I just, explain, the uses and why after their medical provider has done it. And if it's a no, I respect no's, of course, but I get curious about the no. And invariably, the no is because they do not want to touch themselves. They don't want to have to put anything on their labia or to deal with their labia, and they think it's gross to like sit. Their view is that they're going to be sitting in this nastiness in their pants, and that sounds gross. And like, so no. And when I work with women who have recurring UTIs, and again, I'm not a medical provider, so I'm not giving medical advice, but I'm saying to you, so this is the fourth UTI that I've heard you talk about in a session. Just when I ask you how you're doing, and you say I have a UTI and it sucks, like I'm tracking that you've had this many. And if you go to your doctor and it's medically indicated for you to have estrogen cream, then this could be preventing you from feeling this way. And if it's a no, because she wasn't sex educated properly, she didn't know how to deal with genital shame, she didn't know how to deal with looking at her genitals, or knowing that it's an important part of knowing what your genitals look like and how the changes can be, that what you didn't get at 10, and then you didn't get at 12 and 15 and 20 and 30, when you are 55 and you haven't touched yourself, you haven't looked at yourself, and I'm telling you, an estrogen cream could really make a difference. Or if you are 80, and it could literally save your life, because so many women can die from sepsis from a UTI, then we have failed a woman her whole life. And it could have started with a positive ripple effect of, here's your vulva, and this is how different it can look, and it's beautiful in all its array, and you need to know how to touch it. You need to know how it feels. You need to know when it has a difference of lumps, and you need to know how it's going to change color. You know your pubic hair is going to change color. You need to know that there are different creams for this and that. And right now, this may be what you're doing, but later it may be this. We need to be teaching aging in our sex education, so that when you need it, you don't have a mountain to climb in order to get basic needs met on something that is as easy as a fix as sometimes your symptoms are with a cream like that. And I'm not trying to reduce medical advice to something as little. I'm just trying to make the
No,
point of
yeah.
it. There's, of course,
But
lots of
so much
variance.
stigma around that still. Like, there is so
Mm-hmm.
much stigma around even now. I mean, talking about it with our generation who
Mm-hmm.
is trying to self-advocate, talking to our doctors, I also feel sometimes doctors feel stigma or shame to bring it up. So, I mean,
Agree.
there's just so much stigma around it. I love that you said that, because I encourage our listeners to self-advocate, see a menopause specialist, see a therapist, see someone that you need to recognize that you're having these issues, and recognize that you need to, explore and discover your sexual agency. So thank you, Dr. Juliana. I
Oh,
really
you're welcome.
appreciate your time today. Honestly, this was so helpful, and hopefully, is going to change many women's lives and connection with their partner, their families, themselves. Can you tell our listeners where they can find you and your new book?
Oh, thank you so much. And again, I really do applaud you for bringing this topic to your audience, because it often isn't. So thank you for being that kind of woman and provider yourself. But you can find me on Dr. Juliana Hauser on every platform. And I have a website, Dr. Juliana, where you can sign up for a newsletter. And I'll show you my book, which is called A New Position on Sex. And it is an outline and a framework of the holistic sexuality that we talked about earlier. And it releases September 23rd. And you can buy it on all major online outlets where you can buy
Perfect.
books.
And we are going to link it in the show notes as well. And I love the cover,
Thank
by
you.
the way. So it's a
Thank
new book.
you.
So really love the cover. And thank you so much, Dr. Juliana, for being on today. Again, really appreciate your time and your expertise.
Thank you.
Thank you, listeners and viewers, for tuning in. If you want to catch more episodes of Uncover Your Eyes, make sure to follow or subscribe on your favorite podcast platform and on YouTube. To learn more about me, follow me on Instagram at dr.Meenal Agarwal. Until next time, keep those eyes uncovered.